Welcome to Oncology Spotlight, a podcast where we interview those who are working on the war against cancer, brought to you by the OncoAssist team.
My name is Richard Bambury. I'm a consultant medical oncologist at Cork University Hospital. I guess for me, the main news at ASCO 2023, there was a few new pieces of information that I think will advance the science in different areas. So first of all, a PARP inhibitor study of talazoparib with enzalutamide for patients with castrate-resistant metastatic prostate cancer showed again that the addition of a PARP inhibitor to an AR antagonist can improve outcomes for patients in this setting. The big question remains, is this benefit only in patients with BRCA1/2 mutations, or is there a broader range of patients that will benefit? And I think that's a question still to be answered, and whether these agents will be used single agent or in combination with an AR antagonist is still to be decided. I think they'll probably be moved earlier and earlier into the disease settings like castrate-sensitive disease. So I think before long we'll be using them earlier in the disease than castrate-resistant setting. In neuro-oncology, the big news was obviously the IDH inhibitor, vorasidenib, was shown to be of great benefit as a targeted therapy for patients with IDH mutant gliomas. And this is the first targeted therapy targeting a specific mutation that's been shown in a phase 3 trial to be a benefit in brain tumor patients, which is a bit of a therapeutic desert. So it's great to see progress in that area. The question here is how this will be implemented and how it will be combined with the standard of care treatments like radiotherapy, PCV chemotherapy, and repeated surgical debulking for patients with what is a chronic illness in terms of IDH mutated glioma. The other piece of information that's of interest was the adjuvant lung cancer study for EGFR mutated lung cancer patients with osimertinib, showing an overall survival benefit when given adjuvantly to patients with resected stage 2 or 3 EGFR mutated lung cancer. This certainly has the potential to change practice. Again, it's using precision oncology and a targeted therapy personalized to a patient-specific tumor genotype. Some of the criticisms of that study are that not enough patients in the placebo arm crossed over to receive osimertinib. So it leaves the study open to criticism, whereby you could argue that if there was a guaranteed crossover to osimertinib and patients who relapsed were guaranteed to receive osimertinib, maybe that overall survival benefit wouldn't have existed or wouldn't have been as strong. So nevertheless, I think there's a strong likelihood this trial will be accepted by the field and change practice. Lastly, the NATALY study in breast cancer showed some benefit to adjuvant CDK inhibitors in early stage breast cancer patients that are ER positive. It didn't, at least as of yet, show an overall survival benefit. So again, there will be various opinions in the field as to whether this constitutes enough data to change practice, because really what we want to do for patients is give them a medicine that will prolong their overall survival, not just delay recurrence. So that will I'm sure that's going to lead to a lot of discussions in the coming months. For me, they would be my main highlights for ASCO. Thanks very much.